Good afternoon, everyone. Bon après-midi, tout le monde, et bienvenue ici à l'Hôtel de Ville en si grand nombre. Welcome, everyone, to this public session of Moncton City Council. I would like to call the meeting to order.
Your Worship, all public meetings of Moncton City Council are simultaneously translated. Hearing devices are available. You have the right to address City Council in the language of your choice. Meetings are also simulcast in both languages on the City of Moncton's YouTube channel and can be found on our website at moncton.ca. If you've registered with the clerk prior to the agenda, that is 7 days before the meeting, you will be given 5 minutes for your presentation. Other public presentations will be given 2 minutes. You will receive a reminder when it is 1 minute remaining. Please note, no presenter shall speak disrespectfully of council, staff, or a member of the general public. The use of offensive or profane language will not be tolerated. Any breach of this guideline may result in the presenter being asked to leave the council chambers at the discretion of the chair. Un service d'interprétation simultanée est offert durant nos réunions. Vous avez le droit de parler dans la langue officielle de votre choix. Les casques d'écoute servant la traduction sont disponibles. Ces réunions sont diffusées en français et en anglais sur la plateforme YouTube. Les réunions sont également diffusées sur l'Internet à moncton.ca. Si vous vous êtes inscrit auprès du bureau de la greffière avant la date limite, c'est-à-dire 16 jours avant la séance, vous aurez 5 minutes pour effectuer votre présentation. Toute autre présentation du public aura droit à 2 minutes. S'il vous plaît, notez, aucun présentateur ne devra manquer de respect lorsqu'il parlera du conseil, d'un membre du personnel ou du grand public. Le langage assommatoire et les propos offensants ne seront pas tolérés. Le président ou la présidente pourra demander à tout présentateur qui enfreint cette directive de quitter la salle du conseil.
Merci, Madame la Greffière. Before getting started on our agenda this afternoon, we would like to take a few minutes to remember our colleague, Bill Budd, who passed away last week. Bill stood at this podium on so many occasions and diligently and professionally presented planning items. In fact, I think we have ascertained that probably over at least the last decade, he probably stood there and presented more than anybody else. No matter if it was controversial, complex, exciting, or risky, could be a heated public hearing with 100 people in council chambers, or a straightforward amendment to a zoning bylaw. Bill was a consummate, calm, fair professional, always totally unflappable, and a highly trusted voice. He also was an optimist and creative problem solver, always thinking of how to overcome a challenge. I will personally miss his head popping into my office with a, "Hey, Mayor, don't know if I should tell you this, but I've got an idea to run by you." Bill was completely dedicated to this community and positively impacted so many lives. We've received condolences from across the country and North America, actually, remembering Bill and the difference he made in urban planning circles, but also the difference he made through his personal leadership and his down-to-earth humanity. He was an open book, and his kindness and passion radiated through everything that he did. Bill was exceptionally proud of his family. Brian and Megan, you were loved so much. He talked about you and your accomplishments all the time, and your cousin Dylan as well. He loved traveling with you, Cindy, and we are just also thankful to all of you for sharing him with our city. There's a great quote by Christopher Wren. It goes like this: "If you seek his memorial, look around you." And nothing could be truer of Bill, since so much of the growth and the shape of our city was a result of all of his thoughtful expertise and dedicated passion. Bill has left an indelible mark on our city and on all of us. He made us better. I know we will all miss his humanity, his kindness, and his unbridled passion for making our city everything it could be. We will really miss Bill. Mr. City Manager.
And thank you, Your Worship, and on behalf of administration, I'd like to say a few words as well. Bill will be missed here at City Hall for his larger-than-life presence, his calm demeanor, His detailed explanations of some obscure condition on a rezoning application, but most of all, for the pride he took in his work and his team members and their accomplishments. I've been reminded over the past week of just how far-reaching his impact has been, of the influence he's had on his profession, and how many individuals benefited from the pleasure of knowing Bill. Despite his impressive talents and abilities, Bill was very humble, and I imagine he would be very uncomfortable with the recognition this evening. He never looked to be in the spotlight, which perhaps is all the more reason to take this time to recognize and honor him tonight. When it came to planning matters, Bill was often, and in fact, almost always, the smartest person in the room. But he made everyone feel listened to and would patiently explain why we could or could not do something until everyone understood what was at play, and many times using Bill Buddhisms, as was indicated yesterday. Bill's contributions to the city are immeasurable, but those of us who've worked with him will count his legacy not in the number of development projects he led, and there were many, but in what he brought to the staff and management team of the City of Moncton. He was a mentor to many, a source of information and knowledge on all things planning, a colleague who always had a smile on his face. We are very grateful for the many years we've had with him. We are all better for it. Thank you.
Thank you. Deputy Mayor.
Merci, Madame la maire. Merci d'être ici avec nous ce soir. Bill était vraiment une personne exceptionnelle, dont j'ai eu le privilège et le plaisir de travailler avec pendant plus de 17 ans. C'est vrai qu'il commençait souvent nos conversations, comme Madame la maire l'a mentionné, avec « I should not tell you this ». J'ai entendu ça souvent. Cela dit, il était là pour les citoyens et les citoyennes. Je me souviens de nos conversations au sujet du patrimoine. Il avait bien compris la différence entre le patrimoine tangible et le patrimoine intangible. Lorsque les citoyens et citoyennes du quartier de Sonny Bray ont commencé à manifester leurs inquiétudes par rapport à la démolition du quartier et de son histoire, il a compris l'importance pour la communauté de sauvegarder l'histoire de ce lieu. Il a nommé un comité de citoyens et de citoyennes présidé par le conseiller Henderson pour essayer de contrer la disparition de ce quartier. Le projet du plan de Sonny Bray nous a permis de travailler avec la communauté pour assurer sa survivance et de partager son patrimoine qui fait de ce quartier l'un des plus anciens de notre ville. Il était non seulement un planificateur, mais il était aussi un visionnaire. And I will add a few words in English. He was a very patient person because many of us would come and visit him, sometimes unannounced. And I remember that when I would travel, I used to take photographs and come and see him and present these photographs and suggest that perhaps we could do better from an aesthetic perspective. And he loved that. I really felt that he really did. So, and I remember many conversations about the history of planning, which I knew nothing about. But we had conversations about projects such as the Radburn model, which I had to Google to find out what it was, but I discovered that in the early 1900s, in the U.S., this was a model that now has National Historic Sites recognition. It was a pleasure sharing ideas with him and our vision for a city. And like our mayor mentioned, we also had some great chats about our children, and he was so, so proud of both of you. We will really miss him. Thank you.
Thank you, Deputy Mayor. We'll maybe take just a moment of silence and we can all reflect on our time with Bill. Thank you. And thank you for being here with us tonight. It's very meaningful. And thank you again for sharing Bill with us.
Your worship, we have an agenda before us and there are no changes.
Thank you. Is there someone who wishes to move the agenda? Thank you, Councillor Richard. Is there a seconder? Thank you, Councillor Kingston. All those in favor signify by saying aye. Aye. Opposed? Motion carries unanimously.
Next is conflict of interest et déclaration des conflits d'intérêts.
I do not see any.
We have no adoption of minutes or consent agendas. Next is public presentations. The first one up this evening is a presentation from New Brunswick Medical Education Foundation Mission. Alyssa Long, Executive Director, is here to give that presentation.
Terrific. And tonight, I believe we have 3 public presentations. Each will be given their allotted 5 minutes. So we will hear all 3 and then take questions after we've heard all 3 presentations. Alyssa, the floor is yours.
Thank you very much, Your Worship. Councillors, thank you so much for having the New Brunswick Medical Education Foundation here this afternoon. We are here today to present very quickly a rare thing, which is a good news story in New Brunswick's healthcare sector. So over the next few minutes, I'd like to share with you our story, our results, and our impact, because what we have found is a model for physician and nurse practitioner recruitment that has proven to be not only the most cost-effective in the province's history, but the highest yield model. And we know that New Brunswick, in every region, but Moncton is very much included, are suffering from critical physician shortages. So our aim as a foundation is to change that and enhance access to healthcare for all New Brunswickers. So a little bit about our story. We were founded in 2010 by a group of physicians approaching retirement themselves who became increasingly concerned about what would happen to their patients when they retired. They were concerned that those patients would become orphaned and didn't see the influx of young doctors who would come in and meet that need. And of course, that need in New Brunswick is significant. Across the province, there are 180,000 people today without access to a primary care provider. But what's more concerning for us is that the average doctor in New Brunswick is 49 years old and quickly approaching retirement themselves. We're not only looking to address the imminent crisis, but the future crisis and future outlook for New Brunswickers. And in Moncton, we see this crisis reflected on a smaller scale, but certainly just as important. We've seen since 2002, the number of Moncton residents with access to a family physician or nurse practitioner has dropped from 90% to 81%. Just 29% of residents with a provider who are lucky enough to have a provider can get an appointment within 5 days. And we know that populations who are low income, who may be newcomers, face additional barriers to care. So our model is simple yet effective. We raise funds as a registered charity to support New Brunswick medical students and nurse practitioner students who commit to practicing in New Brunswick once qualified. And the results have been significant, and I will stress that we are only 14 years old, and these are the numbers we've produced thus far. Since inception, we've supported 318 students. In just 2024, we awarded 149 scholarships, totaling $1.1 million in tuition support. All of those are return to service scholarships, meaning those students are going to come back and practice medicine in New Brunswick. 57 of our graduate alumni are now practicing in New Brunswick in all regions. And what's even more exciting is we have a pipeline of 226 current students, medical residents, who are committed to practicing here once they finish their program. And our students are representative of communities all across New Brunswick. In fact, 47 different hometowns today. And I'm very pleased and proud to say that we support 50 students currently who are attending the CFMNB campus here in Moncton. And chances are many, many of them will remain in Moncton and work here and serve Moncton residents once they're graduated. So we know that in addition to that representation, 64% of our current recipients are bilingual, 45% are from historically underrepresented groups as well. So what goes even beyond simply these numbers and the quantitative impact we have, the number of students we're putting out, is we actually commissioned an economic impact report back in 2023 to say, what is the value that a physician brings to a community like Moncton? And the results were incredibly impressive. We know that within 10 years of a family doctor opening a practice here in this city, they would generate roughly $2.85 million towards provincial GDP, $130,000 towards municipal tax revenue. They would see about 8,000 patients, create over 3 full-time jobs, and would contribute roughly $1.2 million in induced household spending over that 10-year period. So while we love to provide this enhanced access to healthcare, it is so exciting to know that there's a business case behind the work we do. So the next is, why are we here today? And it's to share, again, a good news story in the healthcare sector. We have a model that's working. We're engaging with partners in the healthcare sector, with municipalities, with the provincial government, to say we have something that's working. Please help us share this story. Help us get the word out there. And we are developing a firmer and firmer foothold in the Moncton region. We've historically been underrepresented for scholarships, but that's something we're hoping to change. So we would love to engage with you and figure out how we can collaborate to make a difference together. With that, I'd be happy to take any questions. Thank you, Your Worship.
Thank you very much, Alyssa. And if you don't mind, we're going to go through 2 more presentations, and then if there are specific questions for you, you can address them at that time. Thank you.
Great. Thank you so much.
The next presentation is a presentation, Project 1010 Senior Center, and Dennis Cochran, the committee chair, is online. He will do the presentation from online.
I want to acknowledge, first of all, the beautiful tribute we did to Bill Budd. I dealt with Bill in a number of capacities over the years and always found him to be personable, professional, and competent. And I know he's going to be a loss, not just to his family, but to council and his colleagues at City Hall. So I join with you in recognizing his passing, that he will be missed.
Thank you, Dennis.
Thank you very much for the opportunity to speak today. I'll speak fast, knowing that you can listen quickly. 5 minutes is not long. First of all, I want to acknowledge some of the people you might see in the audience. These are, and it's interesting, they're there today not as protesters, they're not there as the enemy, they're there as seniors, and they're there as advocates. And one of the things that Councillor Crosman said at one of the meetings, he said, these folks, seniors, have been the heartbeat of Moncton. They've been the backbone and built Moncton to what it is today. And I'm pleased that so many were able to join today for this presentation. And I know they're looking forward to interacting with members of council as the meeting ends. Very quick recap. Obviously, the Centre at 473 St. George closed in 2022. Efforts were made at Heritage Court to provide an option, and that unfortunately got cancelled. Some services were spread around the city, and in many cases, those were already at capacity. But there was a group of 88 that met after Heritage Court, that project failed, and they came up with 3 things they said we needed and wanted as seniors in Moncton. One was a dedicated staff person, which you've done, and congratulations to Ellen. One was better communication, and from what I can ascertain, that has taken place. But the third one is that they wanted a place for seniors to be able to go to take part in physical and social activities. That's the part we're missing. And that's why we're there today, because we found the place. And we want to talk about that and explain why we think that's the right place and so on. We know you had a difficult decision, and I was at your council meeting in October when Councillor Crosman made the motion with regard to 473 and whether it would be used for the homeless or whether it would be returned to seniors. And at that time, we recognized you had a hard decision. And we said, look, we agree. And whatever you do, we'll want to work with you to find a place. Where the place is was negotiable. What I did say in ending that the fact that there needs to be a place is really not negotiable. So we're here today advocating for a place. We've developed a business plan, we've answered all kinds of questions and so on. So after those meetings, we formed a volunteer ad hoc committee of seniors that were willing to put their time together. We found the building at 1010 St. George Boulevard. the former Womanista Insurance Building. We knew it was for sale. We approached Rising Tide and said what a great project this would be if Rising Tide took the top 2 floors and the upper floor of 10,000 square feet was set aside as a new senior center for Moncton. And Rising Tide was quite excited. They put together the funding, they talked to the city, they talked to the various advocates and so on, and they've got, I think, most of their funding for 30 affordable seniors housing units on the top 2 floors. The discussion they've had with the city about the first floor has been very productive. Originally, we thought it would take 2.09 million. They've worked that out at 1.7. I think they've already achieved 720,000 with the city, and therefore the request is now 980,000 as opposed to the original 2.09. So when we put everything together, we were then said, well, we better define who we are and what we're going to do. A number of people referred us to stepping stones in Fredericton, which is kind of one of the models. So our group put together a whole number of things with regard to our mandate. The mission is extremely important. It's to engage 50-plus community in an open, active, social environment driven by volunteers in a welcoming, safe, multi-purpose space, enhancing the quality of life by promoting wellness to fill the body, to fill the mind, and to fill the spirit. Affordable, accessible, inclusive programming for the 50-plus community in Moncton. So that was the proposal. We presented it to the city staff and since then just made an amendment. It's quite comprehensive. We answered 2 questionnaires from staff, and that was actually a good thing. At first I thought it was a pain, but then I recognized it's a good thing because they drew out some things they felt we needed to cover and needed to do. And if we couldn't cover it and couldn't do it, we shouldn't be here. So we put it together, and I think our plan is very comprehensive and have taken a lot of those incidents into control. We felt the city, when it went in 1974 and created the senior center at 473 St. George, that was needed. It's even more needed now. There hasn't been a great number of additional facilities built since it's closed. In fact, other than a few new programs you've tried to fund, there hasn't been a great deal difference. Mayor, you made a statement at the Moncton Chamber of Commerce, and you made the comment, the population increase is necessary for the future, with thousands reaching retirement age. Those thousands are joining all the people out there already, and they're looking for a place where they can where they can meet one another, take place in social activities, physical activities, and so on. It represents right now 25% of the population of Moncton, which is very significant. So the proposal is 10,000 square feet on the ground floor at 1010 St. George Boulevard. And people say, well, what will make it different than MLCC? And one of the things that this group will be doing will be advocating several programs to be put on for seniors. Part of the facility will be a wellness clinic, where they will do things like balance, work with balance, work with blood pressure, vaccinations. All these things can be going on. Also dealing with some of the financial issues that face seniors that they need assistance on.
Terrific.
I'm running out, isn't
Oh,
it?
it's long gone, yeah. But thank you very much. If you don't mind staying online, and we will we'll come with some questions perhaps afterwards. We have one more public presentation. Thank you.
The next public presentation is a presentation from Recap Health Services. Daniel Pike, pharmacist, is here to give us a short presentation.
Thank you. Before I begin, on behalf of myself and my team, just wanted to offer my condolences to the loss of your friend and colleague. Your Worship, esteemed members of City Council, thank you for the opportunity to speak with you today. My name is Daniel Pike. I'm a pharmacist and current board chair of Recap Health Services. I always like to begin these presentations with a little bit of a backstory on how I got to this point in my career. So I've been practicing pharmacy since 2009. In 2018, I made the decision to venture out on my own and opened up my own small pharmacy on King Street in Fredericton. Being situated downtown, I knew that part of my Practice was going to involve individuals experiencing homelessness, those with substance abuse challenges. However, what I didn't anticipate was how it would shape my career and ultimately the passion that I have for the work I do today. During this period, the federal government, interestingly, put a call for proposals for a national safer supply project aimed at addressing the toxic drug supply that unfortunately had made its way to the East Coast. We developed a proposal very quickly, incorporated a nonprofit organization, and were fortunate enough to be one of 5 clinics selected nationally to be staffed by health professionals, peer support workers, all dedicated to providing outpatient treatment and support for individuals experiencing substance use disorder. The project was funded for 5 years. So from word go, the premise was, well, how can we ensure the sustainability for when our funding runs out? As a pharmacist and business owner, I envisioned a social enterprise model in which revenue from retail pharmacy would be reinvested into the clinic, ensuring financial stability, funding staff, procuring supplies, and covering operational costs. Our first pilot project launched in 2022 with the opening of my pharmacy on Crown Street in St. John, which worked in close partnership with Recap Health Services. The clinic pharmacy collaboration has proven to be an effective, sustainable approach, fostering better health outcomes for the population that we serve. Recap Health Services is the organization I'm representing today, a nonprofit that's going to be establishing itself at 357 St. George Street, hopefully within the next month or so. RECAP stands for Center for Research, Education, and Clinical Care of the At-Risk Population. Since its inception of 2014, RECAP has grown considerably. Initially founded with a small team consisting of a nurse practitioner and a physician, RECAP has expanded into a comprehensive organization that now includes a registered nurse, nurse practitioner, infectious disease specialist, and administrative support. Our core mission remains centered on the screening and treatment of hepatitis C, with a particular focus on the marginalized populations, while also providing primary care and substance use disorder treatment. We strive to provide a low-barrier, judgment-free environment that embraces a meeting people where they're at mentality. At Recap Health Services, we offer a full-spectrum treatment for substance use disorder. We provide traditional forms of opioid agonist therapy, including your methadone, Suboxone, 24-hour morphine, as well as monthly injectable Sublocade. These medications are prescribed by our clinic's nurse practitioner or physician. Additionally, we offer treatment for stimulant use disorder by prescribing common ADHD medications such as Dexedrine, Concerta, Vyvanse to help manage cravings for substances such as crystal meth and crack cocaine, which, as we know, has become an increasingly problematic substance in our areas. Recap Health Services, and this makes us unique as to a lot of other sites, we offer an injectable opiate agonist therapy as a treatment option for those suffering from refractory IV drug use. Approximately, and we know this based on data, approximately 10 to 15% of patients on traditional form of opiate agonist therapy fail treatment. They can be still injecting IV outside of treatment or just not accessing the services anymore. To participate in IOT, we have a thorough screening process that includes a comprehensive intake assessment. Our healthcare team gathers detailed information about an individual's drug use history, preferred methods of use, injection history, and any adverse drug-related events. Once approved, the medication is prescribed by either our nurse practitioner or physician. It's dispensed by our pharmacy and administered by the patient on-site under supervision. No circumstances do any medications leave our facility. Following ongoing discussions with like-minded organizations here in Moncton, our goal is to bring these vital services to this community. I look forward to working together with the city leadership, community partners, and other stakeholders to make the vision a reality in Moncton. Thank you again for your time and consideration.
Thank you, Dan. Perfect timing. Before we go to questions, I would like to hand it over to our CAO. I have a sense that item number 2 might be on many people's minds today, so perhaps he could, Serge, you could give us some insight.
Thank you, Your Worship. Absolutely. Again, as Dennis indicated, we're continuing to work with the group on their proposal. I just wanted to make it clear to Council that we will be inviting the group back to Council in the coming weeks for any point of clarification, questions and details of their project, as we have committed to come to a decision before the end of March. So again, just want to put a clarification to council that the group will be brought forward again to council to I guess, answer those questions in detail and provide points of clarity. So
Terrific. Thank you very much. First up, Councillor Kingston.
Thank you, Madame Addis. Thank you. Dennis, are you there? To Dennis Cochran?
Oh, yes, he is. There he is. Okay, go ahead, Councillor Kingston, with your question.
Dennis, can you hear me?
Here, he's there.
Yeah.
Can you hear us, Dennis?
Yes, I can hear you.
Okay, great, terrific.
Dennis, can you hear me?
Yes, I can hear you.
Thanks for coming on, Dennis. I'm always curious about attendance. Maybe it's my hockey background, but what are we guesstimating for the senior support of the first floor at 1010? Rough numbers, generally speaking, and that's kind of an open-ended question, I know, but I'm curious on that end.
I love open-ended questions. You'll see why. The last membership, when it was MLCC in 2022, was 574. We believe with the interest, and I must mention that we've had 1,417 people give their signature of support for this concept. It's not a petition. People have looked at it and said, we support this. And we have 17 letters from various organizations, some of which have been directly sent to council and some of which we have. We believe there's a huge interest in what we're offering, and we're trying to expand it. We've had discussions with Magma, we've had discussions with Moncton Cares, and there's a number of groups out there that want to collaborate with us to make sure that this center truly becomes intergenerational, it's collaborative, it's working together, and that people have a very warm, safe place to go, not just to take part in physical activity, but the socialization is extremely important. 25% of the population of Moncton are over the age of 60, and a great percentage of those are probably living alone. And this offers a place where they can go, where they can meet, where they can discuss issues and so on and get support.
I think the wellness component is important, Dennis, as you said, because with our expanding population in the city, and I'm included in that group as well, I guess, a longtime Monctonian like yourself. So that's an important part of any project is the wellness component.
Well, part of the facility will be used for a wellness clinic, where we're going to try to bring in professionals, and many of them will come voluntarily, but if there's a charge, members pay less than perhaps other people that might attend. But there's a huge number of people needing these facilities, but they don't know where to go to get it. You know, balance, and a balance workshop is a very big deal when you get older. And so there's a whole number of things, blood pressure, immunization, all those things we think are extremely important. It's important that it be in one place where they know they can access it and where they can get support in achieving that.
Yeah. Dennis, thank you very much. Merci, Madame Addis. Thank you.
Thank you. Councillor Bourgeois.
Merci beaucoup, Madame la Maire. I have one question for Ms. Long, another one for the third presenter, and three for Mr. Cochran. So I'll go by the order that we received the presentation. So, Ms. Long. My question is, this is a unilingual English pamphlet, but I assume that you offer scholarships to French language students who are studying in French language medical schools as well?
That's correct, yes. All of our communication materials are available in both official languages. We certainly should have brought up French pamphlets as well. But yes, we do support, and then students, of course, can apply in either official language for financial assistance.
Okay. Second question is, do you collaborate with, we don't have any medical schools in New Brunswick, but we have satellite campuses, Sherbrooke here in Moncton, and Dalhousie at St. John, UNB St. John. And the research says that the best way to recruit and retain doctors is to train them locally. We have two, I guess we'll call them quote-unquote medical schools. So do you collaborate with these two medical schools and maybe favor their students over other New Brunswickers that would study elsewhere and have a higher risk of not returning back to the province? Or how the two twain shall meet?
There are two answers to that question. So first of all, you're absolutely right. Train and retain is the model of choice for bringing more doctors to New Brunswick. We have the two medical schools, of course, the English language, Dalhousie Medicine New Brunswick, and the French language, CFMNB, here in Moncton. And a few years ago, Petal came out with a stat that should New Brunswick residents who train outside the province in medicine, they have a 40% chance of coming back to stay. But if they train within New Brunswick, they have a 65% chance of staying. But if they actually go through our program and sign these return to service scholarship agreements, they actually have a 75% chance of staying in the province regardless of where they train. So our mandate is we support New Brunswick residents who are studying medicine, and they can be studying at any university in Canada, but because the vast majority are concentrated in New Brunswick, 85% of the students we support today are training in New Brunswick, which means we are investing in the most likely future New Brunswick physician pipeline that there is.
Okay, thank you very much. Good luck.
Thank you very much.
Monsieur Cochrane, merci beaucoup de votre présentation. Puis je veux aussi remercier tout le monde qui est ici, probablement pour le sujet et la présentation de Monsieur Cochrane. 3 questions for you, Dennis. Just give me a second. My computer went out. There. Do you need the 10,000 square feet? Could you do what you're supposed to do or what you want to do with, say, 5,000 square feet?
I've been asked that question a number of times. Conveniently, the first floor is 10,000. We checked around. When we met with Stepping Stones in Fredericton, they have a little over 3,000, and they said, oh, you need a lot more space than we have. And in fact, I talked to them today, and they're actually contracting things out to other locations. The other thing is, it's interesting, and most people, I didn't realize it, this 10,000 is smaller than what the site was at 473 St. George Boulevard. Now, it was awkward because it had an auditorium with 2 floors, and it had a second and a first floor of service. So 10,000 is smaller than what was there. The other thing we know that we have, and from our discussions, there's a few groups that need seating capacity for 250, and they're finding a hard place to go. So we designed it so there's movable walls. The largest room we can put together would be 2,655 square feet. If we only had 5,000, by the time you take the entrance and the washrooms and the office and the coffee shop out, no one else could use the building when there's a large group there. And it's our intention that there are several spots, like a card room, a computer room, a lending library. All of this goes on at the same time, even if there is a big group. So we just feel that 10,000 is a good number. It's interesting, we looked at other locations. You know that the 10,000 square feet is at $110 a square to buy it, which is a bargain anywhere when you look at the price of real estate right now. So, you know, for a little bit of extra money, if we could do with 8,000, it's worth it to go to 10. So we feel that 10 will really give us enough space to serve all the people and the various people that we're going to collaborate with. Magma has some need for space. Moncton Cares. Other groups have, so we think that our space will be well occupied and well utilized.
Okay, thank you. Next question. We haven't discussed this issue with council. We haven't had this discussion yet. We have received your presentation in the amendments and everything else. We initially had a discussion with Rising Tide and the purchase of the building itself, but to integrate the senior center, we are still waiting, and the city manager said that the documents are on their way, and we will soon be discussing it. But the initial discussions that I've had with some of the members of council on senior services indirectly dealt with the center, but the approach we sort of discussed initially, going back at least a year ago, was to see if we still needed a center for seniors, dedicated to seniors, or if we would be better off to have different activities for seniors throughout the various facilities that we have K. Crossman Center off of Louisville Street, the old Y and the new Y, Northwest Y, the Legion, just off of Edmonston, and the pickleball courts and everything else at the Curl Moncton facility. So my question to you is, I guess it's a two-part, but I'll try to phrase it in one question. Would this center at 1010 St. George be a dedicated, in your vision, in your proposal, dedicated senior center for the entire city? And/or could it also be the equivalent of the Crossman Center and the Northwest Y for the West End part of the city as a regional or ward, I wouldn't call it ward, but geographically specific area of the city, or citywide? What's your vision on that?
Well, certainly the proximity of 1010 St. George to most of the West End, both new and old, will automatically cause people to gravitate toward it. So it won't be specifically designed for that purpose, but the location of it will certainly complement that. If there was a group in the West End that wanted a certain function that could be performed in this center, we would certainly look at that as we're trying to collaborate with various groups and so on. So, and when you mentioned the pickleball and so on, we're not taking the place of any of that. We're just taking the place of what was done at 473, making it bigger, making it better, making it more collaborative, making it more intergenerational, and so that people do have a place to go. It's one thing to walk into the Legion and take part in a yoga class, but it's another thing to go in early and meet your friends, have a coffee, stay later to have a conversation and so on. And those organizations are doing the best they can, but the socialization part of this is huge. When I mentioned we had 17 letters from organizations, almost all of them mentioned about loneliness and how loneliness will have an impact on someone's mental health and their physical health. And this is a center where people will meet, they will discuss, they will take part in courses and classes and so on. So we just think that a lot of the other opportunities are great, and it's a good thing that Moncton has those, but this one is really replacing a void that we think we have in the city.
Thank you. Segue to my third question perfectly. What specifically are the activities, if you're not going to replace pickleball, if you're not going to replace it, what are the additional activities that are not being presently provided in the city that would be available from this center if we supported this 1010 St. George Street project?
A good question. Certainly, there are 26 groups that used to rent from 473 St. George. So they've all tried to find a home somewhere else. One of the big ones that went to Riverview, that has now lost their space in Riverview as well, is the Bridge Club. And it's huge. And actually, I was told they pay $1,000 a month rent, so they're quite attractive. But they also offer bridge lessons and things like that. We laid out the properties so that there would be a room for like a computer room where people could go in and access the internet, but we could also bring in young high school kids to teach seniors how to use these computers. That's a skill that's unfortunately not as accomplished in an older generation as it is. Rooms to play cards. One wellness clinic, a large room where we would have these workshops, and like I said, on blood pressure and vaccination and so on. Yoga, we've already had a discussion with the people that do the instruction. So there's a number of activities that can take place. We talked about actually a linguistic club that would go in the morning or at some point in time and talk, because we have a lot of new immigrants. And it's a real unfortunate thing. And I dealt with a property in Fredericton. And I had 3 different Chinese families come to see me, and each of the mothers had to talk to me through their children. How isolating is that? So we want to look at how we can bring, and Magma's been very helpful in this regard, trying to make sure that we have a place where people can go, that they're not embarrassed, that they have to ask questions and learn. So there's all these kind of activities that we think are extremely positive, and we want to refresh it. It needs new life and new energy. And we think that we can do that with the discussions we're having with the people in the audience and seniors throughout town. I'm really excited about learning what your questionnaires brought forward when the surveys were that Ellen conducted, because that should give us a hint of some things that maybe we need that we hadn't thought of. And the 10,000 square feet, and it won't be a 9 to 5 operation. It'll be a longer day, so we can rotate and make use of the space. So we think it's a limitless potential as far as what we can offer, primarily to seniors, but not only to seniors.
Okay, thank you very much, Mr. Cochran. Those are my 3 questions. I'll leave other colleagues other questions probably, but I do have one for Mr. Pike. And it's a strange question, but allow me. I represent Ward 2, which has been inundated with the homeless, with crime, and I clearly have distinguished since the beginning that with the support of the RCMP estimates, maybe 25% of our crime wave is because of homeless. The other 75% are not. They're people who are just petty criminals or organized crime or whatever. But there is a factor associated, a correlation between some of the crime and some of the homeless. And some of the homeless are addicts who will be going for your services, and I completely agree. I have no concerns whatsoever, and I'll defend this project. And I have defended it to some businesses along St. George Street who over the years have complained about, I don't know if the right term is vagabond, but people who just basically hang around and in their opinion, scare clients away. And the issue was raised again when the prospect of your pharmacy/clinic was there. Oh, they're going to hang around. And my response is, well, they have a constitutional right to walk on sidewalks. We can't just take them because we don't like what they look like, because who knows where that slippery slope could go. But my question to you, delicate as it may be, and you don't have to answer it, but what measures, if any, could you implement that? I don't know if there's a big waiting hall for the services that they could access, especially during the cold winter months like now, that they wouldn't be either freezing outside or wouldn't be bothering the businesses who have complained to me. What measures, if any, could your business take or make to alleviate that concern?
Absolutely. Very good question. And a concern that I hear regularly. And one thing to note, this is a common issue that I see in communities, municipalities. It's not a Moncton, Fredericton, St. John. It's everywhere. It's a national problem. And there's so many root underlying factors that lead into homelessness and substance use disorder. We're just a very small piece of that treatment. As far as addressing the concerns, first and foremost, for us as an organization, I think education is the most important thing that we can do. And one of the lessons that we learned in starting in Fredericton, moving to St. John, and now being here in Moncton is telling folks our story, because I think one of the bigger concerns is the misinformation that we see that can be spread around the community as to what the facility does. And the role that we play in treatment of substance use disorder. So first and foremost, leaning on other organizations, working with our stakeholders, listening to the concerns of the public, but just getting out there and educating folks as far as what we're doing. Keep in mind that this facility is a medical clinic. So at its core, it's a medical facility. We lean into the other like-minded organizations that surround us for the wraparound services. So whether it be the services that are Ensemble or Salvus Clinic or down the road at the Hub, Rising Tide, we need to lean on those organizations. We're also not a drop-in center. It is a medical facility where folks can come and access primary care service, get treatment for substance use disorder. They're in and they're out for their appointment, and then they can go on to the other locations where there's services for them to access. We also have security. I'm a pharmacy. I have to ensure that my staff feels safe, first and foremost, or else I wouldn't have a staff. So we have security at all hours that we're open, with a very firm understanding that this is not a location where we expect folks to be hanging out for the majority of the day. They come, they access their service, they get their treatment, and then they go on to another spot. So we've learned lessons, but we've also developed a protocol that has seemed to work in other areas, so to alleviate some of those concerns.
Thank you very much, and best of luck. It's a very important service.
Thank you. Appreciate it.
Merci, Madame la Maire.
Thank you. Councillor Crossman.
Thank you, Your Worship. First of all, I apologize for not being there in person this evening. Come down with a cold, so I prefer not to share that with the rest of those of you in the room. I do have two questions. One for the first presentation, Madam Long, if she was available or still in the room.
Go ahead. She's coming to the.
Yes.
Okay, perfect. During your presentation, you had a slideshow. You were clicking on the screen. I haven't seen that. It won't be in our CRF. So if there's some way you could share that with council, that would be great.
Of course.
Number two is, you made a lot of comments about retention and bringing the people back to work here in the community and throughout New Brunswick. What is your current percentage since you started to where you're at today?
Absolutely. From what we've seen from the physicians who are now out and eligible to be in the workplace, so they've completed the residency program and are eligible to practice within New Brunswick, we have a 75% retention rate to date, which is actually the strongest of any provincial recruitment initiative that we are aware of. And we have now placed alumni in every provincial health zone. And what's more is we have a pipeline of 226 committed to practice in the province once graduated and once their residencies are complete. And what we expect is if we maintain that 75% retention rate, that pipeline could account for up to 45% of New Brunswick's projected physician gap by 2030.
And you're not having any, obviously as the physicians retire and move into retirement, you have a very difficult conversation to have, I would assume. The province of New Brunswick is involved with this as well, our local MLAs or premier, things along this line. So they're engaged in.
Absolutely. So we maintain very strong relationships with both regional health authorities and with the province of New Brunswick, the Department of Health, to the extent that we actually have representatives of all three bodies on our alumni committee. So they're actually aware of the students that have signed these return to service agreements, when they graduate, where their return to service commitments may be if they're regionally specific. And the idea is that will help all parties engage in proactive workforce planning, and we can provide secure physician recruitment leads to those hiring bodies and streamline that transition from student to physician and to a viable, rewarding career here in New Brunswick and their home province.
That's great. And I appreciate your time and thank you for answering my questions, because I think it's very important that we realize not only their careers, but they're going to start families, they're going to start friendships, they're going to grow the economy as well. So I really thank you for that.
Thank you, Councillor.
Thank you. So I do have a question for Mr. Cochran, if he's still on the line.
I'm sure he is. There he is. Go ahead.
All right, great. Thank you. Thank you, Your Worship. Mr. Cochran, during your presentation, you talked about letters of support, and you talked about numerous letters of support. But you didn't touch on who they're coming from, or are they business related, or are they community related? And I don't expect you to go through 17 letters or whatever the amount is. I'm just trying to get a better understanding for the people that are in that room, where these letters are coming from.
Thank you very much. Some were sent directly to the mayor and members of council, but I'll mention some of them. And if I can quote from one or two, it would be helpful. One of the big ones that came was from the Chamber of Commerce. And when they started, they said, au nom de la Chambre de commerce pour le Grand Moncton et des plus de 930 membres, je vous
Thank you.
There's a saying that you might take some solace in, and it's dealing with the process of aging. Yesterday, we were you. Tomorrow, you'll be us. If you want to take a minute to think about that, don't take it on my time. It really is something when you think about it. We're all going to be there, hopefully. And we just want to make sure that we have the support network that people can enjoy a quality of life. Moncton's a great place to live. And it's a great place for people to bring up their family, but we've got to make sure it's a great place for people to age and retire as well.
Thank you. Deputy Mayor Terrio.
Merci, Madame la Maire. Merci à tous pour être venus. Thank you, everyone. And Dennis, thank you for leading this project. My question is a follow-up to my colleague's question about how this center would connect with other activities in the city. So have you thought about that? Do you have a program type of project that could make sure that citizens are not just at the center, but they could they could go to the Capitol Theater for a special event? I don't know, but how would you do that?
Well, we certainly have to have discussions and collaborations. One of the big ones that's taken place so far has been with Magma. And they recognize that they have a seniors population that's coming into Moncton. And they need support. And like I was saying about the multilingual discussion room and those kind of things. So there's a number of things out there that we would like to interact with. For example, the Southeast New Brunswick Adult Education. They've taken over what used to be the GED, and they've changed it to something else now. And they used to have a classroom here where people could be encouraged to go in, meet other people on the way through. And then we might be able to have some of the seniors work with some of the people taking that particular program. There's so much talent amongst our seniors. When you retire doesn't mean it's over. It means that you're just going into a different phase. We've got so much talent out there. A really good one is the Tantramar Seniors College. They take people with experience and people go listen to classes. God love, a whole bunch of people came over the last 5 years to my course. But I feel good because it doesn't mean I got put out to pasture. We all have some talent that we should be encouraged to share. And I think this center will let the students come in, the people taking adult education. It's just so much that we could do, but we have to make a real effort to reach out. And that may be something we should deserve a little criticism maybe in the past. We can't be isolated either. And we've got to make sure that we reach out to people and say, we've got this and we can work together.
And you mentioned, Dennis, that we make up 25% of the population in Moncton. Perhaps it's time to look at our budget, our global budget, and look at what 25% of the budget means for our senior citizens.
Certainly fire and continues to protect us all, but you're right. And we're hoping you'll take a little piece of that and look at what we're trying.
We could discuss snow clearing and see how much the seniors can walk
Yeah,
on our streets.
seriously.
I do have maybe a comment for Mr. Pikes. Really thank you for what you're doing and for bringing this to service to our city. And I keep talking about the aesthetics of this. So how can you make this place look good? It's a follow-up question to my colleague, Conseiller Bourgeois.
Thanks for the question. Again, it's a medical facility, so the space that we're going in at 357 St. George already, in my opinion, is a nice looking building with good curb appeal, good signage as well, will be top of mind for us, but also keeping and ensuring that the site is kept tidy. One thing that we notice at our other facilities is our patients take great pride in the facility. We're a very unique program. The 3 sites, well, soon to be 3 sites that we run are the only ones on the East Coast that operate this type of injectable program. And there's great pride amongst the community of participants that access that service. So they'll often be the ones that are out front sweeping the front step or cleaning up garbage and, taking ownership of that property. So never been an issue to date as to problems at our other locations.
And you will be working with downtown Moncton, I'm assuming?
Yes, yes.
Great.
Yep, yeah, I already
Wonderful.
met with Patrick, yes.
Thank you.
Yep.
Merci beaucoup. Merci, Madame la maire.
Thank you. Councillor Steves. Oh, you were on. Sorry, you turned yourself off. There we go. Put you back.
Mayor Arnold. I have two questions for Alyssa, if she could come to the mic, and then I'll go to Dennis Cochran after that. Alyssa, it is indeed a good news story. Thank you for bringing a good news story. In fact, all three that we're discussing here today is going to ultimately be a good news story. I hope the media picks up on your story as well, because there's people outside this room that need to hear what you shared with us. It's very encouraging, for sure. You were so positive that I wonder, are there any current barriers that your organization is facing? And then my second question is, have you had an opportunity to share this presentation with our new provincial government?
Yes, well, first of all, thank you so much for your kind words, Councillor Steves. We are incredibly proud of the work that's been done and recognize that we stand on the shoulders of giants whose vision made this possible, in particular, Dr. Donald Craig, who was the original founder of this organization and the Return to Service Scholarship model. We have grown in a very short time to be not only a proven solution for physician recruitment, but actually one of the largest scholarship programs in Canada that we are aware of today. We award over $1 million in scholarship in tuition relief annually, but we're actually projecting to do between $1.2 and $1.4 million this coming academic year. So the growth has been significant, and we're thrilled. However, our biggest barrier is the fact that we are not able to support every eligible applicant in New Brunswick today. Last year, we had to turn away approximately 20% of qualified applicants, all of whom were willing to sign a pledge to practice in New Brunswick, a legally binding pledge. So my dream, and the dream of my team, and I know our volunteer board of directors, is to grow to a point where we can close that gap. And to do that, we would need to award an extra approximately $400,000 to $500,000 a year in tuition relief, or grow our program by 20 to 30%. And that level of scaling would allow us to meet the need and bring that many more physicians to New Brunswickers that much quicker, enhance access to care, and contribute to an overall solution to our staffing crisis. We have delivered this presentation to the Minister of Health. I have presented to the Premier, and I think we're all aligned that this is a huge program with huge results that needs to be scaled.
Thank you very much.
Thank you.
Okay, I'll move my next question to Mr. Cochran. Thank you so much for your enthusiasm and your communication. You're fun to listen to. Dennis, I'm hung up on the word intergenerational. I'm very aware of what an intergenerational environment looks like. I'm part of one every Sunday. That means about 30% are under the age of 18 for my context, intergenerational. I keep hearing about a senior center, but when I hear intergenerational, which really perked my ears tonight, does that mean children? Does that mean teenagers? Does that mean 20-something young adults? And why use the word intergenerational? Is that just trying to make the case stronger, or would your pitch be stronger if you focused on just seniors? I'll let you respond.
Good question. There's no doubt that we've been encouraged to use the word intergenerational. There's no doubt about that. It won't be children. We don't want to daycare. We don't. Seniors have their grandchildren and they want to interact with young people. But probably from one of the things we're looking at, for example, is a lot of the high schools have volunteer credits and they have co-op ed. Wouldn't it be a great place for a young person who might think of going into gerontology or seniors care and so on to come and work? So we would go down probably to high school. We're not expecting them to come and play cards or things like that, although we might teach them how to play bridge or chess. But I guess we're not opposed to that. And I always say it's primarily for seniors, but the Board of Management will decide how far out they're going to reach. And like I said earlier, a lot of seniors have great talent and great ability and can share it. And if we find an area in our population that could benefit, one of the things you often see at Remembrance Day is veterans talking to high school kids, because it's going to be forgotten. And if you forget war and you forget what caused it, and you end up getting back into it again. We should all pay attention to that one. But anyway, so we certainly are prepared to reach out, but it won't be inundated with, we have a Boys and Girls Club. I do their option every year. It's a good program and so on. And we don't want to take their work, but if there's something we can do to help, we'd certainly be willing.
All right, thank you for the clarity.
Councillor Leblanc. Poussez le bouton. Oh, c'est là. Oh, et voilà.
C'est pas là?
Oui,
Oui,
maintenant.
merci. This is for Madame Long.
Yes.
Yeah, yeah, interesting. So, my question is, do you consider supporting like the newcomers? There's a lot of newcomers that come here. They were either a nurse or a doctor in their country, and most of them, they have to go back to school because their certificate in their country is probably not, but that's another story. So do you consider these also?
Absolutely. First of all, I will say international recruitment is a huge and critical part of the solution to meeting the physician and primary care provider shortages. And we recognize that and we fully support the work that's going on to bring those professionals in. I would say for us, per our letters patent, we are restricted to supporting tuition expenses only. So if a former physician who's looking to requalify is looking to do so, and if so, they need to enroll in a university program, they would therefore become eligible to apply for funding.
Okay, thanks.
Great, thank you.
Councillor Legier.
Oh, thank you. So I have three questions, I guess. So maybe, Ms. Long, if you wanted to come up, I wasn't quick enough to ask you to stay there. But so thanks for the presentation, and certainly it's nice to see an initiative like that that really does, I think, give value to our young population. They're studying medicine. They also see the challenges of an aging population, the complexities of medicine. Having spent my career in the pharmaceutical industry, I certainly have seen the changes from when it was back when a young physician started their practice, and most of the time, a bulk of their population were similar ages, and they saw their patients' children grow up and so on. But now it's not quite the same, where immediately they're seeing very complex patients, and it's very challenging. So I think what you're doing in terms of investing in their future and our future, I think, is really valuable. My question, though, is I know there's a real focus on the medical side, but what about other medical professions? I mean, we're seeing the collaborative approach, which is what GPs now are favoring with nurse practitioners, with mental health supports and so on. And would there be any room in your program eventually to recognize nursing, for example, as well, and in terms of helping them along in their careers and helping us achieve maybe a level of care much faster?
Absolutely, and thank you for the question, Councillor. We recognize that physicians do not practice in isolation, and that is a view that echoes back at us through the students we do support. The medical students we see come through our program are saying that they are being trained to work with and rely on other healthcare professionals to assist in the delivery of services, simply because medicine has become so complex compared to what it was 30 or 40 years ago. You're absolutely right. So knowing this, in 2023, we actually expanded our letters patent to allow the foundation the ability to support students not only enrolled in medicine, but in a number of other allied healthcare professional programs, including nurse practitioners, nurses, pharmacists, OTs, and a number of others. Now, we are bound per the agreements with our donors. Most of our scholarships are still specifically targeted for future physicians, but we have the ability now to take on new scholarships that support students enrolled in other healthcare professions. We have done that, and I'm very pleased to say there are at least 4 nurse practitioners who will be supported this year coming through our scholarships, and we are adding more and more almost every month.
Okay. Well, thank you. That's it's very encouraging, and thank you for sharing that information with us tonight.
Thank you very much.
Thank you. I guess my second one would be if Mr. Cochran is still there.
You here?
Hello, Dennis. Just some thought. I mean, I think the what we've heard and certainly the need to have a wellness approach and so on, I think is the direction I believe that we're seeing out in the community. I guess my question is, one of the, I mean, I've been on council long enough to have spent some time in seeing the previous center and how it functioned and so on. And there were some challenges. And so from a bilingual perspective, you know, even the presentations that we get recently and things, is there going to be a bilingual component where we begin to really sort of bridge all of us together in this center and make everyone feel comfortable, including newcomers?
Yes, there's no question. We put all of our information out in both languages, except for the original proposal. That was a deadline and trying to get it in time. And it would be our intention that the executive director would be fluently bilingual. We'll be relying a lot on volunteers, and obviously we'll try to take the volunteer that's bilingual and put them on the desk, those kind of things, so the interaction with the public is very much bilingual. We'll actually have some aspects of multilingualism as well, but that won't be. It'll be one of the two official languages. We'll follow the rules and regulations that New Brunswick puts out, and happily do so, because we've got a huge population of seniors in Moncton that are unilingual English, not likely too many unilingual French, but we want to make sure we can serve everyone.
So I think, you know, when I look at this, for me, it'll be really important to have it well laid out in terms of the partnerships that you and your group can strike with various groups within our community. We formerly used to have a resource center at People Park Tower for seniors. I remember that years ago, and it was likely federally funded, and lo and behold, it disappeared. So I think there is definitely a need for a place to go where you can access services, and whether they're medical services, whether they're computer literacy, whether they're library services, encouraging maybe a relationship with the library. Those things, and as well, I mean, you know, we've touched on the gerontology program that's at the University of Moncton. I mean, there would be, you know, I think huge opportunities to bring them into this as well. And the other piece too, in terms of social isolation, because it occurred to me, so there will be 30 apartments in that building. And one of the things that Rising Tide has discovered in terms of their housing population is that it's easy to house someone, but then all of a sudden, if you don't provide the support services and so on, they're in their apartment and really nothing else is happening. So I think there might be a great opportunity for that interaction with those 30 apartments with this particular wellness center, and as well the proximity to People Park Tower, who also mentioned that they have a fair amount of isolation because there are some programs, but not a ton of things happening there. Maybe your comments and just some thoughts that you can maybe bring back when it's more than just a financial exercise. We have to be very careful and make sure that this is something long-term. And I would agree that, you know, this is probably the best opportunity for a location. I congratulate you for finding it. And then I think the partnership that you're working on. And then finally, it's tough because everyone's volunteer, and we're expecting a lot from council because we make a financial decision. But I think you've come a long way, and you know, just maybe your thoughts and glean into what would be important when it comes to council to make that long-term decision.
Well, certainly the location is actually probably prime. There'll be 30 apartments upstairs, but there's probably a couple hundred at People's Park where their services are limited. But for example, the people from this center can go to People's Park to the credit union and those kind of things as well. A lot of apartment buildings in Moncton now have a social room, but they don't all have it. There's huge apartment complexes that don't have that, and the huge number of seniors that live in their own homes don't have access to those kind of facilities. So we certainly will be encouraging people to come as a center, even if it's just for information. because it'll be there. We'll create this. We have had discussions with the federal member, and New Horizons is wide open to all kinds of innovative projects. And we certainly will be looking at that in order to make sure that we can expand the services we offer, or make sure that people understand what services there are there. And we realize that, this is it's a leap for council. You've got to, we're saying, trust us, we're going to run this, it's going to be sustainable. And I think we can. And we've got a lot of volunteers. And when I mentioned about volunteers and their expertise, some come with financial expertise as well. So we'll be tapping into them to make sure that this can run successfully as a financial venture as well. But we think the potential, the location is ideal, the bus routes and so on, access to Wheeler, all those things. And we'll be good neighbors, by the way, Councillor. It's an ideal location. The partnership with Rising Tide is unique. And I would suspect it'll become a model that'll be the envy of many other municipalities to see affordable seniors housing over top of a municipally sponsored center for seniors. And I'm proud of that, and I hope that we'll work hard enough so that you can be proud of it too.
Well, thank you very much, and certainly look forward to the next steps. But again, the expectation to have all of that together, I think you've certainly come a long way in the last month and a half, and certainly look forward to more details. So thank you. And I would have a question and a comment, I guess, to Dan, if you wouldn't mind. So thanks for coming this evening and sort of presenting what the clinic can look like here. And certainly there were rumors long before you made it official that you were coming, and of course people create their own narrative on what it could look like. And certainly I think you've come a long way. But it was interesting, I had a conversation with a business owner in Fredericton. And I think it's important because what we heard here, because it's like anything else, you hear all of the worst things that could ever happen, but now you've gone from the Fredericton pharmacy to St. John and out of Moncton. And the comments were very optimistic in terms of your willingness to work with the community, the communication, just the overall turn of events, I would say. And I think that's really important. I think for our downtown, it is always stressful because we have so many services that are in a very small area, right? But I must say that you're a welcome addition. I know that HIV testing was being done at a clinic further down the street from yours. I don't know if that is going to remain because you're going to be doing some as well. I'm curious on that. And maybe not. So you'll offer those services, and so on. But in any event, I think that's you're starting off on a good foot. I think that people are nervous. However, both the Chamber of Commerce and Downtown Moncton Centre-Ville, when we did our task force, there were recommendations in there. Mm-hmm. And one of the recommendations was to have exactly what you're opening. Yep. And so the question then becomes, how do we as a community make it as successful as possible? And so I'm happy that the doors, with DMCI and with the Chamber are open. But that comment related to your Operation in Fredericton was just shared to me out of the blue, and I thought it was really interesting. And they feel that it will be very successful here in Moncton.
Yep. Well, I appreciate hearing that from Fredericton. By all means, we've obviously had some challenges with predominantly misinformation. One of the challenges we had in Fredericton was around opening in the midst of COVID. So we had a lot of difficulties there with getting our story out, but also with the inability of our clients to access really any services at that juncture, right? We were one of the few places that remained open throughout the hardest times of the COVID pandemic. So again, I appreciate your comments, and Moncton as a whole has been tremendously supportive of our program, and we really look forward to working with all the organizations, with the municipality. It's been tremendous, the support we've gotten, so thank you.
Thank you. Merci.
Councillor Richard.
Thank you, Mayor Arnold. Welcome, everybody. Nice to see lots of people tonight. Just a couple comments for Alyssa and Danielle. As was mentioned, the bilingual side, if we make sure that that's not forgotten. I know, I'll just let you go at it.
No, we understand that the province has needs for services in both official languages, and as I had noted, 64% of our current recipients are fully bilingual, plan to practice in both official languages, and can certainly meet the demand.
Yep, that's great. Also, for Danielle, I hope that your services are also offered bilingually. You might have some staff there.
Yes, absolutely. But our staffing will be able to serve our patient population in both official languages, so not a concern there.
That's great. I mean, that's all we're looking for, to make sure that everybody's covered.
Yep, absolutely.
Thank you very much. Is Dennis still there?
I'm sure he is. There he is.
He's not
Don't
going.
go away that easily, you know that.
You're not going
we
anywhere.
know.
I know.
You see my next project.
Great. I can't wait.
Easy, buddy. All right. There's still lots of questions to ask and answer. So, but along the comments from Councillor Steves, we're talking about the intergenerational side. We're calling this a seniors center. So, is there any change of name or something might happen here, or we're looking at intergenerational? I mean, it's for sure to include, so everybody's included, not just to have a seniors center, just not to have a senior center. Sorry.
I've always defined it as primarily for seniors, and then it goes from there. And the Board of Management of Seniors will do it. We do have to caution ourselves and caution you. We can't be all things to all people, and we know that. And we've got to make sure that what we do well. And our prime constituency are people over the age of 50 to 60. But we can reach out and share the talents of those people with all kinds of others. So we'll work at that, but it's gonna have to not only just be us willing, but others also wanting.
Absolutely. No, and I'm just asking the question if there was any appetite for that. One thing that I'll be looking for once all these questions are asked and answered, and we see some final literature on this, hoping to see some outdoor spaces available as well, not just the inside. I mean, don't lock them up inside. Let's let some people roam around and have some fresh air. I know St. George might not have, whatever. We still got some trees out there, so.
It lends itself to that. If you go to the site, there's an outdoor patio at the entrance to the first floor, which we're going to keep and maybe expand it. The other thing that's really attractive, we're right across from Centennial Park.
True.
There's all kinds of things that can take place there. Wayne Harrigan runs a walking club, and they go to different walks and so on. But what a great place to start in the morning and head out to Centennial Park. You could walk 10 different ways throughout that park. So it's obviously, the location lends itself to that kind of activity, and that's exciting.
Yeah, you just missed a round of applause here behind you, so. But,
I can't hear them. They've been well behaved, I must say.
oh, yeah, hooping and hollering here. So, upon Councillor Bourgeois' comment asking if it was for areas in specific, and I'd like to, I see one of my Ward 4 neighbors here, so it's glad to see that everybody's included here. So, merci beaucoup. Thank you.
Councillor Butler.
Well, thank you, and I guess first will be last and last will be first. So I would like to start off with Miss Long, if she could come. You're getting lots of exercise anyway, getting up and down. Thank you very much for your presentation, start off, and it's a great thing that you're doing, and you and your group, the foundation. One of the things that I was amazed with, that for $450,000 that for the government or organizations, be it cities or whoever's hurting for medical care, is $450,000 would cover that 20% that we're missing. And maybe you could, so $450,000, how many really more applications would we get with that?
What we would be able to do through those extra funds is give financial support to up to 30 to 40 more students per year, which would allow us to successfully fund every eligible medical student or potentially nurse practitioner who is willing to sign that pledge to return to New Brunswick. Now, I say that tentatively simply because the number of seats in medical schools could expand, which is something we would love to see. The number of nurse practitioner placements could grow. So I think there will always be a need for small growth within this program. But we've been very fortunate in that we've actually more than doubled the number of scholarships awarded within the last 3 years. So we've seen that tremendous growth and significant investment. We're just really hoping to get that little bit more to close the gap.
So, on to Councillor Bourgeois, he stated that, there's some satellite medical schools, but has there ever been any thought from any provincial or federal governments that we'd have a medical school right in province of New Brunswick?
I'm not sure I could speak to that.
Okay, sounds good. So, with this extra money, has the provincial government, have they given you any indication that they might be thinking about it, looking forward to having more conversations with you?
I think there have been a few very productive conversations, and like I said, a great working relationship with the Department of Health. In 2023, they actually coordinated a $2.5 million investment in this program, intended to provide an additional $500,000 per year for a period of 5 years, which would end in 2027. So our hope is certainly when we come to the end of that agreement that they would renew that support. We've also been very fortunate to partner with 12 municipalities so far who have created scholarships for their specific regions. So we are very fortunate in that we're in a space where everybody is a stakeholder, whether you are a private citizen, a corporation, municipality, provincial government, etc. Everybody has a stake in healthcare. And I think, we've seen investment come from every sector because of that, and that's something I'm incredibly appreciative of. Foundations, again, are another wonderful contributor, including the Friends of the Moncton Hospital Foundation.
Well, that's awesome. As far as scholarships and things like that and bursaries, would you be able to send that along to us to just see how the other municipalities are doing that?
Absolutely. I'd be happy to.
All right. Thank you very much.
Thank you, Councillor.
I'll keep Dennis to the last, because he will go. Dan, if I could just ask you a couple questions there, if I could. Thank you very much for your presentation and what you're doing for the community in Fredericton, St. John, and I hope it works very well here.
Thank you.
One of the things that I have heard is that on social media as regards to the education close to you. There's schools close to you. Harrison Trimble was talking about it. It's a little bit farther away, but they still have some issues. Edith Cavell is just around the corner. These students see a lot of that's an inner city school. So I'm wondering if, have you decided to do some type of maybe a communication program where you would go and meet with the education, like maybe with Edith Cavell, maybe put them at ease to exactly what you're doing, because there's a lot of rumors, right? People see this and they think, oh, there's going to be a lineup of people down the street to go get their methadone and, things like that. So what do you say to them?
Absolutely. I think, thank you for the question first and foremost, but yeah, that's been top of mind for us to meet with any of the schools in our surrounding area. Actually, today I sent a follow-up email trying to schedule something with the principal at Edith Cavell. So that is top of mind, obviously, to curb any concerns or anything that we can do to help alleviate some of that. I think one thing that I keep trying to come back to is the overall goal of our program, specifically around the IV, the injection program, is to decrease that visible drug use in the community. So essentially what we're doing is giving folks a prescribed medical treatment as an alternative to using illicit substances on the street. Okay, so we're ultimately trying to alleviate some of that visible drug use that we're seeing. We're creating a safe space where patients can come and access safe drug supply with safe injection supplies as a means to reduce that. So when I'm speaking with schools or even other business owners, other stakeholders, that's one of the main points that I try to make is overall we're trying to decrease the amount of drug use that we're seeing in our communities and putting it into a medical facility to help get our patients stabilized.
Yes, as I read what you're doing, I think it's a great idea, but there's this stigma that comes with it, if I can say, regards to just down the street from you, that there's people hanging around, there's people sleeping in the backyards, there's needles being found every place. So that's why I'm saying it's for this to get off on the right path. I think that we should try to do some type of thing with the communication to the, not just maybe to the school, but that whole community. Maybe even have a neighborhood meeting.
Absolutely, and we've done that through Downtown Moncton. So we, in conjunction with Patrick at Downtown Moncton, organized an in-person session for all business owners. I think they did a 2-block radius, 3-block radius of our location, and brought everybody in to give them, this is the clinic, this is what it looks like, this is our services, this is how we're mitigating any potential loitering or anything that would disrupt their business. So community engagement has been top of mind for us, and we're kind of going through, and this is just one piece of that, is to get in front of council. But yeah, I couldn't agree more. It's
and just by ending, Dan, I would say is that one thing about the Monctonians, it's like the seniors here. They like to have somebody they can call.
Yep.
So with this, there should be. I would hope that if people in the neighborhood are having an issue with your business when it opens, is that there is a phone number that they can call.
Absolutely.
Express, and I think that's important.
When and this goes back, I'm dating myself now, but when I first got into pharmacy, I'm from a small town just north of Fredericton, and the pharmacist there could be reached evenings, weekends, holidays. So I've tried to bring that same mentality into not only my nonprofit world, but also my pharmacy business, that there's somebody that you can pick up in the phone and call. And speaking to Mr. Legier's comment about some of the connections that I've made in the Fredericton area, the businesses really close to me know that they can reach me anytime if there's a concern. So
yeah, I think that's very important. And thanks, Dan, and the best of luck.
Thank you.
Thank you. And now to Mr. former Mayor Dennis Cochran. There he is.
Still here.
Still here? Are you in Florida?
Not at all. I'm excited.
I was waiting for a Trump sign or something there. Not a good one. Dennis, a couple things that, I had the great pleasure to sit on the seniors board at St. George when I was there with Wynn and them. You're right. There's a lot of very, very educated people, well-written, well-read, that can bring a lot to a community. There's absolutely. I was amazed when I sat on there for 4 or 5 years at what they brought and what they had and what they could offer to the community. And I think sometimes that even in them days when we had on St. George, I don't think we took advantage of everything that we could have had with them. But one of the things that I would, from being on that board that time, when you talk rentals, I would really, I would hope that we never get back into that we have to rely on rentals, because it really puts a lot of, I know we went through an awful time at St. George with the rentals. Somebody would leave, and then we'd have a hard time getting somebody to come back in, and then they were out money. And then the people that were on the board, they were worrying that they'd have to come to council. So this is one of the things. So maybe you can answer that one first, and then I got another one.
Well, you're right, and I think the impression that some of the council may have had was that MLCC spent much of their time chasing money and rentals.
Yeah, that's right.
And to some extent, that's necessary and needed, but it can't be the prime objective of the organization. The request of the city for the grants at this point is double what it would have been back when MLCC finished. We've reduced our staffing and all those kind of things, because we're going to rely on a lot more volunteers. So I think, and even in the budget projections that we put forward as a committee, we never cut the rentals above $60,000 a year. The last year that MLCC was there, the rentals were $79,000 in the year. Pretty impressive, but at the same time, what extent did you have to go to get that? And we want to make sure that our volunteer committee that looks after that is not necessarily going to in a conflict with the other volunteer committee who are looking after programming and so on. You want us to be sustainable, but chasing money can't be our prime objective. Our prime objective has to be to serve seniors and the community with the program.
Yeah, I agree. The next thing is that, sometimes it's a little touchy topic, but I think it's got to be, all these touchy topics have to be spoken about. And I think that as a gatekeeper for the Moncton citizens, taxpayers, I have to think about what's best for their money. And so when I ask this, sometimes when I'm talking to people, there's been a couple at my house that talked to me about this, and they were from different areas. Could have been Riverview, Shediac, Dieppe, and they're all talking about this 1010. And I wonder how we're going to look at this regards to spending Moncton taxpayers' money, and trying to explain to everybody that everybody's coming from different areas. So is it a Southeast regional center? Is it, does somebody else put some money in? These are questions that people are asking. We have to be out front with them and ask them, so feel free, go ahead.
And they're good questions. It's primarily to serve Moncton.
Yeah.
And there will be some people from outside. Age doesn't recognize Halls Creek or Petitcodiac River.
Taxpayers do.
There'll be families across in Riverview, supporters, they've grown up together, and we'll encourage everyone. But at the same time, it's primarily for that 25% that are in Moncton. We will have a differential fee.
Okay.
A small difference if you're from outside versus inside. We don't want it to drive anybody away, but we want it to recognize that, yes, it is Moncton that's paying for this. If you want to take the proposal to the Southeast Commission, I'd be glad to go with you. I had a discussion with them. I've come to the conclusion they're reviewing their programs, but they seem to be very cumbersome. Anyway, but I did have a conversation with them to see if there was an option. It just didn't appear to be feasible at this time. So there will be primarily Moncton, a slight differential fee, and we do need some outside participants to help make it feasible and make it sustainable. But your comment's a good one. But I do find that relationships and friendships among seniors know no municipal boundaries. And we hope that people will come together from everywhere to enjoy what we have.
I couldn't agree more. It's just that when we talk to citizens that were spending their money, they will ask that question, and it's good to be able to have an answer for them. So I guess with that, I'm really looking forward, because I know our staff is working really hard with council also. With I'm sure that everybody here agrees that we have to have the data to produce to show that we can do this, and I'm looking forward to our staff coming back with the data, and then because when we do this, we want to do it right. We don't want to wait a couple years and say, oh my goodness, what did we do here, right? So I think the live data coming back is going to really help us make that decision. And I would hope that that's how all decisions are made by council, with some data. And I'm sure, you're out there, you're gathering data, so, we have to do, and I think we're working together. And I think everything will come together at the end, and we'll be able to figure out something, how this works together. Best for everybody.
I appreciate that. We've done a lot of work, and I must say the two questionnaires were very piercing, which caused us to say, well, gee, we must do that. The last one was very comprehensive, and I answered it. And I'm happy that they're questioning. I don't want to be associated, nor do all the people in the room want to be associated with something that's not successful. And if it weren't needed, we wouldn't be doing this. So what we have to do is find a way to make sure we can meet the need, but at the same time, make sure that it's successful and not a drain on the taxpayers' dollars. I'm chief, so it works for me.
Absolutely. Well, they still love you by the applause.
Yeah.
Thank you.
So thank you. We've made a complete tour, I think, of everyone. I'm going to go back to Deputy Mayor, but I'm hoping that we can wrap things up here. Go ahead, Deputy Mayor.
Merci, Madame la Maire. I have a question for Ms. Long. Thank you so much for what you do. This is really great. You mentioned healthcare providers, but does this include prevention, preventative medicine? Is that something that is part of the process? We do treat illnesses, but and that's very costly. So how do we prevent illnesses?
I think one of the greatest services that we can provide as a foundation, as a private foundation that is separate from the government, is helping to reallocate resources. Because if we can leverage this pipeline that we have of incoming talent that's committed to the province, we can save the province and the departments of health and the regional health authorities some of the resources that they're spending to bring in this talent themselves and to recruit. And with that extra funding available, potentially maybe that could be invested in preventative health care. We are not engaged in the provision of healthcare services. I am by no means an expert in any of that. I'm not a healthcare provider myself, nor am I an expert in the system. But my hope is that we can relieve the strain that's on the system by increasing access to primary care, by increasing access to world-class trained professionals who know New Brunswick, who love New Brunswickers, and are willing to spend their careers here. And if by doing that, easing the strain can allow for more effective use of the resources we have at hand, we'd be wonderfully happy to have a part in that.
This is wonderful, but I think we also need to find ways to educate our public on taking care of themselves and how to eat properly. I know there are efforts out there, how to exercise. We've just been talking about seniors and the issue of loneliness and how that can impact our health. So I think it's just very, very important to make sure that that is included in everything that we do for healthcare.
I couldn't agree more with you. They say that so many of our resources can be addressed or mitigated, so many of our challenges through exactly what you're saying, which is preventative health care, and through education is a huge component of that. I think that we have seen across the province, but especially in Moncton, among reports by the Chamber of Commerce here, that healthcare, access to healthcare, and other healthcare challenges, like you say, are one of the top 2 or top 3 concerns of all businesses. And it's become a business issue, it's a personal issue, it's a family issue, and a government issue. And I think only by working together and collaborating can we identify and pursue the solutions that are most effective and most likely to make a difference. And they're certainly solutions that go far beyond the work we're doing as a foundation.
Thank you so much. Thank you and good luck.
Thank you so much.
Terrific. I think that concludes all of the questions for tonight. I'd like to just wrap up by saying to Alyssa, thank you for being here, and that your report has now been distributed to all of council. They can get it on their e-scribe. Dennis, I hope wherever you are, it's a lot warmer than here. And just really thank you for bringing all your friends here tonight. It's great to see council chambers packed. This doesn't happen every week, and that's okay. And to Dan, thank you for bringing this important service to our community. I would just add to Councillor Legier's comments, I also spoke with that business owner in Fredericton. I've also spoken to the mayor in St. John, and they're very, very supportive and have had no issues. So we're happy to welcome you to our community and look forward to working with all of you to make it an even better place to live. So thank you very much to everyone for being here tonight.
Your Worship, the next item on the agenda is planning matters.
Maybe we'll take a 5-minute health break. How about that? Yeah.
Yeah, so, but it is therefore.
Okay, I think we're ready to get back at it.
Okay, planning matters, introduction rezoning application 195-225 Leopold F. Bellevue Drive, and Dylan Geldart is here to provide an update.
Can you just press your button? There we go.
Wonderful.
Welcome, Dylan.
Thanks. Yeah, so plans are being prepared to construct a new mixed-use development at Leopold F. Bellevue Drive. At full build-out, the development is expected to accommodate 366 residential units, as well as 373 square meters of commercial space that will be distributed through 4 apartment buildings. The property currently falls within 2 zoning designations, so it's the property zone integrated development as well as R3 multiple unit dwelling, which permits both the residential and commercial components to the proposal. However, based on the scale of the development, administration are recommending that the entirety of the lot be rezoned to ID, integrated development, for continuity purposes. But at the same time, we're also recommending that a smaller portion of the lot be downzoned to P2, open space and conservation, to recognize the location of a watercourse as protected buffer. Okay, so the property is located within Ward 4 and is known municipally as the Halls Creek Village subdivision, which was a large area that in 2012 was master planned and rezoned in 2012. What we have here are the existing zoning and what we're proposing. So on the left-hand side of your screen is the existing zoning that's in place, integrated development, which we don't come across as often, as well as R3, and we're simply proposing to extend that ID zone, like I mentioned, across the entirety of the lot, and then rezoning a smaller portion closer to the Vision Lands to P2. Okay. So historically, the purpose of the Halls Creek Village subdivision was to accommodate a variety of densities and housing types, and Leopold F. Bellevue Drive really served as that dividing line between the south and the north. On the south side of Leopold F. Bellevue Drive was always envisioned, it was always envisioned on the southern side of Leopold F. Bellevue Drive to accommodate lower density types of developments, so single, 2 units and townhouses. And for the most part, from my understanding, the south side is fully built out today. Meanwhile, the north end, or the north side of Leopold Bellevue Drive, was meant to accommodate higher density apartment buildings in the area, as well as commercial. So the properties that are in question today are encircled in red and located on the north end, where when this plan was approved in 2012, it was they are permitted to build up to 168 residential units, as well as 1,487 square meters of commercial that could be built there today, as of right, without having to go through the rezoning. But the new owners are proposing to modify those plans. So instead of the 6 buildings, they're looking to build 4 apartment buildings. That would have, like I mentioned, 366 residential units opposed to 166, and then reduce the amount of commercial from 1,400 square meters to 373 square meters of commercial. They'll be distributed through 2 buildings. So the first of the 2 buildings, like I mentioned, it'll have commercial, and those commercial components, we tried to really keep the status quo of what's permitted there today. So the existing zone, the integrated development zone, allows for personal service shops. It allows for restaurants, dental clinics, for example, office spaces. So we really want to maintain the nature of those commercial uses. We have added a few, such as daycares, to the list of permitted uses, and the full list is attached within the draft conditional zoning agreement that was forwarded to council in advance of this meeting. The development here, what we're proposing, would take place in 2 phases. So the first phase would consist of buildings A and B located closer to Leopold F. Bellevue Drive. And the reason for this was to keep the existing density counts in line with the approved plans of 2012. So Phase 1 here would accommodate 215 residential units, which is approximately 47 more units than what was approved in 2012. But like I mentioned, they'll be reducing the amount of commercial on site by 1,114 square meters across the entirety of the site. Phase 2, on the other hand, will consist of buildings C and D, so those two buildings that fall outside the red highlighted area. And what administration is recommending is that those buildings would only be permitted to proceed once the full connection between Leopold F. Bellovo Drive and the Vision Lands is completed to help with vehicle circulation and providing a second access to the subdivision. In terms of the street layout right now, so Leopold F. Bellovo Drive is that main east-west collector in the Halls Creek subdivision. But right now it ends in a temporary turnaround with the intent that it would eventually connect to the Vision Lands via a new street. Now, what the plan that we have here is the draft road network for the Vision Lands that I'm using for illustrative purposes, but none of these roads have been assented to by council, nor are there any strict timelines or anything that are in place for these connections. But I guess the most important part of this is to know that Phase 1 and 2, Phase 1 would be able to move forward as is if this amendment were successful, and then Phase 2 would be it would require some level of connection to Crowley Road Farm Road, and this has also been communicated with the applicants who understand and accept this arrangement. So here we have the elevation drawings of the proposed building. So this is Building A, which would be the first building that's proposed to be constructed as part of Phase 1. It's a high-quality built form that meets the downtown design standards. So this is a higher build form than what we would often typically see in the city's more suburban parts. Here's another aerial view. So the part of those two buildings, Building A and Building B, that are abutting Leopold F. Bellovo Drive, that's where the commercial component is proposed to go. That will create a hub in that area for not only the neighborhood itself, but for students who are just looking maybe for somewhere to go during their lunch hours. Today, administration are recommending that Moncton City Council proceed with the proposed zoning bylaw amendment, being Z-222.43, by giving first reading of the bylaw tonight, referring the bylaw to the Planning Advisory Committee for its written views, and then setting a public hearing for March 17th, 2025 at 4 p.m. in Council Chambers, City Hall. The rezoning, if approved, should be subject to a conditional zoning agreement attached as Schedule B, and would have been part of your e-scribe packages. As a next step, I mentioned we'd be looking to go to the Planning Advisory Committee as early as next week, and then we come back on March 17th for the public hearing. Thank you.
Terrific. Thank you, Dylan. Councillor Richard, I have you up first. Did you wish to move this recommendation?
I'd like to question the recommendation because it doesn't mention that we're talking about Phase 1 here, right?
We're talking about Phase 1 and 2. We'd be
Both are,
rezoning.
okay, I just wanted to clarify that. Yeah,
Okay.
I'll move the motion.
You'll move it?
Plus, I
And-
have some questions.
Councillor Bourgeois, did you wish to second it? Okay. Back to you, Councillor Richard.
Merci. Thank you, Dylan. As we had discussions yesterday, every time I looked at this, I saw Bill's name on it and still thinking of that. So thanks for the group for being here and sticking together. I know it's been tough, so. Back to my pages here. The traffic signals will only be installed once they get the permit, once they,
No. Would you like to address that? Sure. Okay.
I'll let you finish the question. Was that?
well, I'm just wondering, when do the lights go in at the
the-
corner of McLaughlin and Leopold Béliveau?
All right, thank you for the question. The traffic signals at McLaughlin Leopold F. Béliveau are planned for 2025. It was a combination of growth in the area, but also existing conditions, especially making a left turn out of that intersection is quite quite tedious. So it's planned, budgeted, so things it's going to happen this summer.
Okay, and in the CRF, it mentions crosswalk is expected at some point, considering the commercial component of the development and the desire of residents and students in the area to walk over. So the crosswalks aren't in the plans yet? They're not planned, they're not, or are they?
No, so this would be referring to the, I guess, the crosswalk, which would be right in front of the development. So this would be based on volumes at the time. We do have like a crosswalk warrant analysis that we can do. So it's going to depend on, again, the demand, the need, and the traffic that's there, both pedestrians and vehicular.
Okay, so similar to TAC?
Yep, exactly. Yep, we could do warrant analysis as development grows. We understand it's not going to be required right away, but eventually down the road, it might
Soon
be a
enough, though.
requirement. It could. It's going to follow our same procedure where we look at certain areas that may require a sidewalk, whether it's a concern or even our own internal staff that will look at the data, and so it's going to follow the same procedure.
So TAC will decide if there's lights, if there's
Correct.
rapid flash or whatever?
Yep.
Yep, okay, merci beaucoup.
Thank you.
Thank you. Councillor Bourgeois.
Merci beaucoup, Madame la Maire. J'ai une question. Do you have any concerns at all about the parking arrangement? This looks like a pretty big parking lot in the middle of 4 buildings, some of which are commercial, and then that would make sense to have that kind of parking lot, but it's also residential. So I'm trying to imagine somebody being in a hurry, wanting to drive diagonally through the parking lot to access, because they're in a hurry or whatever, the store or pharmacy or whatever dentist appointment would be on the lower floor on the extreme north of the development. Any concerns at all?
No, there are no concerns with the parking arrangement. It was actually at our request that we made sure that the parking, everything was behind the buildings, so it wasn't visible from the street from a planning perspective. But then the other part was that if you look at the site plan more closely, you'll notice that there's a comprehensive connectivity for pedestrians to be able to walk from one part of the site to the commercial components. So we made sure that that was a focal point within the development, and that it was accessible by foot throughout the development.
So maybe I missed it in your presentation, but the 2 buildings facing Léopold Béliveau would have commercial, obviously. Would the 2 behind it, Phase 2, have commercial components on the first floor as well?
That's a good point. So it's not shown in the plans or anything today, but the way that we've written the agreement is that we are open to having commercial as part of Phase 2. Yes.
Okay.
So the flexibility is written there so that they could have commercial in either of those buildings as well.
Okay. As long as you're safe with the parking arrangement, to me, I see a lot of red flags, but I'm not an expert, so I'll rely on your expertise. Merci. Merci, Madame la Maire.
Thank you. I don't see any other questions at this time. I think we could move to the vote, but before we do that, I'd like to say thank you to Dylan. I understand this is your last week, and it's been great to have you at the podium and make many presentations. So thank you very much for your service, and good luck in your new adventures.
Thank you.
To the vote. I need. Oh, yours are not working?
So can we show of hands?
Okay, I'm, all those in favor signify by saying aye. Aye. Contrary minded? Motion passes unanimously. Thank you, Dylan.
Thank you, everyone. Good evening.
The next item is statements by members of council. Les exposés des membres du conseil.
Councillor Bourgeois.
Merci beaucoup, Madame la Maire. I have some good news on public safety in our city. In 2021, Moncton had the 3rd worst crime rate in Canada, as well as the 4th worst crime severity rate in Canada. I just checked last week and I found out that in 2023, the latest updates that was produced by Statistics Canada, the crime rate improved. We have now the 10th place, and the crime severity index, we are now ranked 12th. We did hire more community officers and RCMP members a couple of years ago and are about to hire more in 2025 and more in 2026. Boots on the ground matter. However, they do not explain the reduction in the crime rates because we only started in 2023 when we had this data. So I want to thank the citizens of Ward 2 especially, and notably Krista Mullins-Jameson, Christy Gallant, Greg Fearon, and Peter Colwell for keeping public safety on the front burner after the issue was relatively neglected from 2019 to 2021. They came before council to request public meetings, and in 2022, they showed up and provided some 30 solutions, and we are still working on it. But we still have a long way to go to catch up with St. John, whose crime rates are half of ours. Also, we are way above the national average in minor thefts and breaks and enters, as well as in family violence. Nothing to brag about. We need a game plan. We don't have one. No objectives, no strategies, no prevention measures. We only have a list of action items, and the actors act on their own. We need a concerted and evidence-based plan that integrates the efforts of the federal, provincial, and city governments, and we need targets and follow-up. Minor thefts, family violence, and drug trafficking are not uniquely Moncton problems, but we have a much higher rate than all other cities in the Maritimes, so there's something here. We need particular solutions from all three levels. These problems affect our citizens, who are common to all three levels. But first and foremost, Moncton City Council, as the representatives closest to the affected citizens, must lead by example by, first of all, admitting the crisis, and secondly, making public safety our city's #1 priority. Our new strategic plan is about to be adopted. If it does not put public safety first, it won't be strategic, in my opinion. After almost 4 years of relative neglect and lip service, it's time this council gets serious about crime. Once City Council admits the crisis and puts the priority where it should, the province and the federal government will follow suit, I am sure. Merci, Madame la Maire.
Thank you. I see no other comments at this time. I think we can move on.
Okay. We have no reports and recommendations from committee in private ou des rapports de l'administration. Readings of bylaw, les lectures des arrêtés municipaux. Council has given me permission to give first reading to bylaw Z 222.43. These will be posted on our website and can be requested if they want email or by mail. Bylaw and amendment of the City of Moncton zoning bylaw being bylaw Z 222.43, rezoning at 195-225 Léopold F. Bellevaux. First reading. Arrêté par la modification, l'arrêté de zonage de la ville de Moncton sur l'arrêté Z 222.43 195-225 promenade Léopold F. Bellevaux. Première lecture.
Merci, Madame la Caffière. I think that concludes tonight's agenda. Councillor Richard, would you like to make a motion to adjourn?
Yes, I would.
Thank you. Thank you very much, everyone. Have a great evening. Stay warm.